Welcome to Sunday Scaries, Preventing Sunday Scaries with Dr. Henry Ernst. I'm your fearless leader. Welcome to a Father's Day edition of Preventing Sunday Scaries. And I will say this, if you have a father out there, you're lucky enough to still have a father in your life there. My father passed away when I was 24. Hug your dad, break some bread with your dad, give him a call. You should be very fortunate that you have a father in your life there, because I haven't had one for a long time and I'd be really appreciative if I did. So, little tidbit there. Sunday scaries, the things that are in the pit of our stomach on Sundays, when we're having to go to work on Monday, when we're trying to think about those darn things that are going to give us a lot of stress. And those can even happen on a Father's Day Sunday. So, today, I can almost guarantee I'm going to provide the number one, maybe top 3 item that will cause you Sunday scaries, right? So first off, I wanted to thank a listener in Ohio, Tom. Tom gave me some great feedback. He said, "Hey, I'm really digging the Sunday scaries. I'm listening on the way to work, and just thanks for what you're doing." So if you're liking the videos, you're digging the community that we're creating here, please, my only ask, hit the like button when you're watching the video, hit subscribe so you'll always make sure that you're getting these videos. And hey, if you want to leave a comment, something about this video, something about the scary tip of the week, or maybe a future thing you'd like to hear about, please leave that feedback. I'd really be grateful for that. So here we go. I'm going to give you a typical scenario. What's the number one thing that will cause us Sunday scaries, in my opinion? We're thinking about our appointment schedule on Monday. Could be for dentistry, could be for any business. And we're always thinking, we're thinking about that one person. Oh my gosh, this person's on the schedule tomorrow. Oh, snap. I said, oh, snap. I'm making a proclamation here. I'm not cursing. This is going to be a family show. So if you're driving the kids to work, you can always feel, comfortable to listen. So you see that person on your schedule, you say, oh, snap. Can't believe I got to deal with that person tomorrow. I'm telling you how much mental energy, and I call them time vampires, do certain people just occupy in your mind, on your schedule. It ruins your whole mojo for your whole day, right? Causes lots of stress. There's certain words that people will call these patients. Some people will call these patients PETAs. We all know what the acronym is for. So, Sunday Saver of the Week. Here we go. My suggestion, do it yourself, or if you want to have more fun, gather your team, and hey, let's make a list of all that in my office, we call them LAS. That's our acronym. Because sometimes if you use the acronym PETA, some patients could see that on a pop-up or something like that. So make an acronym of maybe somebody in this world that you don't really like, or just an acronym somebody won't even know. We call them an LAS. So get your team together. I want you to come up with people that just give you so much grief and so much trouble, and you see them on your schedule and you just say, oh my gosh, I'm so stressed today. Why do we deal with them? Why do we have them? We don't have to take care of people. We don't have to do business with people that don't appreciate us, or are rude to our team, or just give us lots of stress. Why? So get your team together, make a nomination list of the people that are giving you the most grief, and you'd be surprised. You may be getting the same people. And if you do have people that are on your list, 1 or 2, fire them. There's no reason why you have to do business with them, right? Now, dentistry is a special, unique circumstance. In dentistry, we can't have anything outstanding. We can't be in the middle of a big treatment or anything like that. And all you need to do, and every state is a little different, all you need to do is give them a notice. Listen, the relationship's not working. We're going to discontinue our relationship right now. You have 30 days. We'll be here for emergencies. That's just the letter of the law and what you're supposed to do. I can't tell you, when you do this, it will feel so good. And your staff will appreciate it if it's somebody who's a pain in the rear, right? I had a patient that I was treating for a few years, and she was always rude to the staff. And sometimes the staff didn't tell me. And she was always grumpy and a curmudgeon. And Eventually, she needed a little bit of work. And I just, one day in my head, I just said, you know what? I think we need to have you go to another dentist. This relationship's not working. And what do you mean? He said, well, honestly, I'll just making up a fake name here, Jane. When you come in here, you're always upset at the staff and you're always rude to them. And you come in here and you're always complaining about stuff. She was basically making a case to stay. So I stuck with my guns and I said, listen, I really appreciate, the relationship we have, but it's just not working. I'll be here for 30 days, but I really you need to find another dentist. And I can't tell you how great that felt. So I know it goes outside of our comfort zone. This goes in dentistry. This goes for any business. If people are causing you stress, analyze it. Why are you doing business with them? Do you need to be doing business with them? Right? And it's okay to shake hands and say, it's not working out. So feel free to do that. I hope everybody has a great week. I hope everybody had a great Father's Day with your fathers, your grandfathers out there. And please, if you need any help with your dental business, feel free, dentalpracticeheroes.com. Click the little schedule a call at the top right. We're here to have, a conversation, see if we can help anybody. But I hope everybody's enjoying these. I hope everybody has a great week coming up. So let's go out there and have a great week. Thanks for listening.